Good evening, everybody. Thank you for coming. Thank you for joining both online and for those of you who are seeing in the recording. I want to start the evening by saying thank you to Rockport Public Library for giving us a space. Thank you to the candidates who have come all the way over to our lovely little town. Thank you to the Rockport Democratic Town Committee that have decided to become really active in getting the community involved in these election issues. And thank you especially to 1623 Studios who have come all the way over here and got here before anyone else to set things up so that people in all of Essex County will be able to participate in this great event. We're going to have a coin toss. I have Tom Delaney, who is the former chair of the Rockport Dems. If he would stand up, please, and toss the coin, we will then go over the rules. All right. Heads, Virginia, and tails for Kevin. Does that work for you guys?
Fine. That's fine.
And that's who goes first. And the answer is?
Heads.
Heads. Okay, Virginia, you will be given the first. So the rules for this evening are quite simple. We're going to try and keep it tight. 5 minutes maximum for opening statement. This is Barbara Gavin, who's very kindly being our timekeeper. When you get to 30 seconds before your time is up, you will see this very subtle 30. When you exceed your 5 minutes, you'll see that.
Okay.
We ask you to respect the times. Questions came in from all over the area, outside of Cape Ann even. So it covers from all of Essex County. So I'm very excited about that. There were a lot of questions. We've had to whittle them down to keep respect to the time. So we're going to do 5-minute opening statements. 2 minutes per candidate per question. If either candidate makes a statement directed at or about the other candidate, should the person who's just been nominated have the desire to rebut, they will be allowed a 30-second rebuttal. Optional, not mandatory. In the event that you keep your answers faster, we can answer more questions. So it's up to you. We can have lots of things covered or very few things covered. Please respect the time. When we're at 10 minutes before the end, I will give each candidate a 5-minute closing statement. Virginia, you will go last since you are going first in the opening statements. Is it okay to be on a first name basis with everybody?
Absolutely.
So if you would introduce yourselves, I'm Nathaniel Mulcahy. I'm the chair of the Rockport Democratic Town Committee. I'm very proud to be part of this. And we'll start here with the two candidates. To my left, we have first, if you'd speak to the cameras.
Sorry. Good evening, everybody. My name is Kevin Coppinger. I am the sheriff here in Essex County.
Good evening, everyone. My name is Virginia Lee, and I'm the candidate for sheriff on the Democratic ballot this year.
All right. So, following the rules that we've just laid out, are you agreeing with the rules? Would the two candidates like a brief break at the halfway mark, or should we just barrel through?
Oh, we can barrel through.
That's fine with me.
That sounds
Fabulous.
fine.
All right. Can you both hear me, or shall I remove my mask for the questions?
I can hear you.
You're fine.
Okay, great.
Good.
So, I'll get my questions. And we'll start with the opening statements. Virginia, it is up to you to begin. 5 minutes, Barbara. Tell them when they can start.
Start.
Good evening, everyone. My name is Virginia Lee. I'm a licensed clinical social worker, and I'm running to be your next sheriff of Essex County. Folks, there's a real choice in this election this year. It's a choice about public safety, about trust, and about the central question of what kind of justice system we want to have right here in Essex County. If we look around, our county is struggling. Our overdose deaths are up 14% in the last year alone, and our recidivism rates have been flatlined for the vast majority of this term and even from the last at 47%. Our system of rehabilitation, in other words, is failing almost half of the people it is serving. Many of us avid voters in Massachusetts find ourselves leaving the sheriff's ballot blank when we go to the polls because we honestly don't know what the sheriff does or why it's important to us. And the leaders that we do elect are either career politicians or have law enforcement experience or are simply appointed to the job but do not possess the actual skills for the sheriff's work in 2022. Even our most conservative sheriff in the state has acknowledged that our jails are more like hospitals than what we imagine jails to be. This is because prisoners at the county level are serving lower level sentences, often averaging just a few months, or are awaiting trial. And many of the sentences served are related to crimes impacted by substance use, mental health, crimes of poverty, and crimes of necessity. Folks, our status quo methods are not working, and I truly believe that we can do better. What we need is a chief clinician who has both the experience to hold people accountable and rehabilitate. The sheriff has the opportunity to infuse our correctional system with a culture of rehabilitation, not retribution, of trust and transparency, not secrecy and politics as usual. I'm a bilingual clinical social worker with 12 plus years of experience working in community mental health, and I have a deep commitment to the communities and vulnerable populations I serve. I have worked in detention centers in Massachusetts and in Mexico. I have worked in schools and clinics. I have worked with victims of crime, perpetrators of crime, individuals suffering from major mental health problems and substance use disorders, and I'm skilled at working across the boundaries of language and culture as a bilingual provider of clinical treatment and director of training. It's not enough to promise to lean in and be proactive on substance use and mental health, but then have to be dragged across the finish line by pressure from the U.S. Attorney or lawsuits by the ACLU until you honor the evidence and provide prisoners with medication-assisted treatment for opioid use disorders. It's not enough to claim that reentry starts on day one, but then wait 5 years and an election cycle to roll out a new reentry program. We can list and we can even fund as many programs as we like. But if we aren't committed to those programs, if those programs aren't effective at helping people to transform their lives, then we aren't doing our job. The status quo finds recidivism rates in the 40s acceptable, even something to be proud of. As a clinician, I find that appalling. Rehabilitation and the culture of retribution cannot coexist together. We live under a system right here in Essex County that withholds the causes of death from prisoners, not just from the public, but from the families of prisoners that have been lost. We can do better, and we can do better not just by the folks that are in our care, but also by correctional officers and victims. Folks, 6 years is a long term. We have had our current sheriff since before Trump took office. This is an opportunity for change, and I ask you to consider my perspective this evening. Thank you.
Okay, thank you very much, Virginia. Kevin?
Well,
Wait, Barbara gives you the go?
Go ahead.
thank you very much. And Nathaniel, thank you to the Rockport Dems and the committee for putting this evening together. Folks, my name is Kevin Cloppinger. My background is I was a police officer in the city of Lynn for 32 years. The last 7 of those years I was police chief. I have worked with a lot of different incidents, different crimes. I've seen crime at its worst. I've seen the root causes of crime. And 6 years ago, when Sheriff Cousins retired, I decided to run for sheriff because I wanted to make a change. What I saw in my previous employment as a police officer, what I learned, there are better ways to do it, and that's why I ran. The Essex County Sheriff's Office is a large organization. It's a $78 million budget, 600 employees, 200 vendors or volunteers, 1,126 inmates on the average today, and thousands of visitors who come into the facility. It is a criminal justice law enforcement agency that serves not only the courts, supports local and state police departments, but also serves individual communities based on need. It's a large, complex organization. I believe my experience in Lynn, running a $20 million organization with 200 employees, has gained me the experience and the expertise to run the Sheriff's Department. And I believe I have done that over the last 6 years. In 2016, when I ran, I made some promises to those that were voting at the time. First and foremost, I promised I would increase staff accountability and training. I have done that. Our motto at the jail is honesty, integrity, and respect for all. I increased in-service training hours, by 8 to 16 hours, depending on who it is, and we made sure our officers are trained to today's best standards. I also have put in additional training for specialized levels for all supervisory training, all the way up to my level. I also made promises in terms of substance abuse treatment, because my days as a police officer, as I said before, I saw the good and the bad and the ugly of society, and the opiate epidemic, which has been devastating our communities for years. I thought there was a better way to do it. So when I got to the Sheriff's Department, that's one of the first things that we did. We created several units inside the jail to help address the opiate epidemic. And while my opponent does mention the ACLU and a lawsuit that occurred back in 2017, we were served with a lawsuit, but bringing in medication-assisted treatment into a correctional facility was far from any norm in any jail across the country. This was new ground. We did research it. We did get a directive from the judge to participate, but we embraced it. And we built out a medication-assisted treatment that's one of the first in the country, that's located here in Middleton at our House of Correction. And it has been called a national model. We have also programs for those that want to go clean and sober. We have a clean and sober existence unit for folks who don't want to be on medication-assisted treatment. And we've also stepped up to address the mental health issues that we have so far in so many of our communities. For example, we obtained some grant money, and we created a COPE unit, create correctional opportunities for personal enrichment. We take individuals with low-level mental health issues who are in our jails, moved them out of traditional cell, put them in a dormitory-style housing unit. We hired extra clinicians, and we bedded them on the unit during the normal workday so they can almost have treatment on demand. Mental health treatment has been one of my priorities during my tenure as chief of police, but also as sheriff. We have close to 30 licensed clinical social workers working at the Essex County Sheriff's Department that we brought in to do the task. I even hired our own Director of Clinical Services, a woman with 27 years of experience in all forms of mental illness, who is an ace in my book and is a very professional, intelligent woman who really serves the population with her whole heart and soul. We've also looked at programs for our inmates while they're inside. We have them inside, so let's use them, offer them programs to help them increase their chances of not coming back, to reduce that recidivism rate. Programs in the educational field using Northern Essex Community College or Merrimack College. Programs in the vocational field, teaching them how to work in the restaurant industry, the construction industry, hardscape, where they work in the landscaping industry, building walls and landscape patios. We have employment opportunities for these individuals. We also teach them trades in the construction industry so they can work in fiber optic cabling. What we do now, I believe, works. My opponent mentioned the recidivism rate. Our recidivism rate dropped 5%, 5 points last year, which is excellent. And our statistics show that the longer a person stays with us, participates in our programs, and works out through our step down to our pre-release centers, that recidivism rate drops to 31%. What we are doing works. We have the statistics to show it. We now have a very vibrant reentry program. I just got the stop sign, so I'm going to respect that and say thank you very much.
Thank you very much, both candidates. Now, with those were very serious talks. I really appreciated the depth with which you approached the subject. We're going to ease things up a little bit with a softball question, just to kind of lighten the mood for everybody. We've all had the pandemic. We've lived through the period of the pandemic. During this pandemic period, have either of you taken up a new hobby or binged watch a specific show? And if so, what was the hobby you decided to take on for the pandemic, or what show did you binge watch? Kevin, you're first this time.
Well, you might think this is a weird hobby, but when the pandemic started, because of the nature of coronavirus, I started watching the wastewater level testing throughout the Commonwealth of Massachusetts, because that is a predictor of where the next phase of COVID was going to happen. And believe it or not, when you watch those numbers, it is a reality. And by watching those numbers, I can then prepare for another spike in COVID inside our facility.
Okay. An unusual hobby. Virginia?
Well, in addition to when the pandemic hit, I was working in Chelsea in the epicenter of the pandemic, and I primarily, a lot of my volunteer work is in Lynn, which is where the epicenter moved as soon as it left Chelsea. So a tremendous amount of community outreach, case management, supporting people's affordable housing, and making sure that people didn't go without food. But I'm a clinician, and I understand the importance of self-care and of making sure that I am meeting what I know I need so that when I come out every day to do the work that I do, I'm ready for it. So one of the things that I did was I played a lot of music. And I also did a lot of art. I'm a painter, and I'm an old-time musician. So it was a joy to entertain my children when we had no childcare and had to scramble, and also to make sure that when I was going out to do that very difficult work, I was bringing along with me the tools for healing and reconciliation with lots of the conflict that came also along with that.
Thank you both. It's nice to see a more human side to people. So the next question is a little more hard-hitting, I'm afraid. What is the most pressing crime-related issue in Essex County, and how will you attempt to solve it? Virginia, you're first.
The most concerning issue in Essex County to me is substance use. It is oftentimes the undercurrent for lots of other crime, some violent and also the crimes related to feeding addiction. And it is so important that we make sure to put the right leadership in charge of the right spaces of public safety so that when people are struggling, that they get the help that they need. You know, the job of the sheriff is to be the chief rehabilitation officer in the county. This means that the sheriff cannot be waiting for justice or waiting for progress to catch up to that person. This means that the sheriff has to be aware of and proactive on all of the latest issues, treatment, and effective ways of managing and mitigating substance use and substance use related crimes. This means that we have to ensure that the person who is in our leadership has an understanding of the clinical implications of substance use, the social determinants of health that impact substance use, and therefore also not have to wait until other entities pressure us into being on the right side of progress. We have actually had sheriff's departments across the state who implemented and embodied substance use treatment, medication-assisted treatment, before Essex County. We have to make sure that we're doing better. And the crimes that are related to substance use disorders, in my opinion, are the most serious and most important ones for the sheriff's department to be tackling.
Thank you very much. Kevin?
I would just expand on what my opponent said. I don't disagree with the substance use disorder problems, but I would also add the mental illness, because those are the two driving factors, in my opinion, based on my experience, that are part of the root causes of crime. And when you look at an individual, and we do this when an individual arrives at the jail, we do an assessment. Why are they here? You look at the whole totality of the circumstance, what brought this individual here. And if they have a substance use disorder, or a mental illness, we want to make sure we try to address it and get that individual stabilized, and then, as I said before, get them treated, get them programmed while we're inside, give them those services that we can while they're incarcerated so they can succeed when they leave. And if we don't address these correctly, my fear is that when they go back to the community, they will recidivate and there will be a higher crime rate in our communities. And I think if you look today, even pick up the Boston paper, there was a youth that was shot and killed last night in the city of Boston. There are more and more shootings coming up. And I do disagree with my opponent when she said we need a chief rehabilitative officer or something like that. Keep in mind, the Sheriff's Department is a law enforcement agency. We do respond, we do go out in the field, and we do assist local law enforcement. That's part of our goal, that's part of our objective, that's part of our mandate. So when we look at the social service part of our job, we do perform those to the best of our abilities, and I think we do it pretty well. We offer all those 100 programs, we try to individualize them as best we can, and we bring that individual into the fold so they get that treatment. And the latest program, as I started to mention earlier, our STAR program, our reentry program, takes those services we're offering in the jail, now we offer them in the communities. Right now in Lynn and Lawrence, we're our two busiest communities. So we have a continuity of services going back into the community. We have navigators assigned to the individual so they don't get lost in the shuffle of recidivism and they have a better chance of success.
Thank you. Virginia, you were directly mentioned. Would you like a 30-second rebuttal?
Yes, please. Thank you. As my opponent mentions, the root causes of crimes, especially those related to sentences served at the county level, are substance use and mental health. This means that we are in a position, uniquely in Essex County, to actually put an expert on substance use and mental health in leadership in the department. It's important to remember that the actual job of the sheriff is the care, the custody, the treatment, and rehabilitation of prisoners, not law enforcement.
Thank you. Actually, that segues, both of your answers segue very nicely into the third question for this evening. And Kevin, you get to lead with this one. Would you support the implementation of programs where the first responders to mental health issues are not law enforcement?
Yes, in a varied way. And I did this when I was chief of police in the city of Lynn. We created a behavioral health unit where we hired a civilian clinician and 2 caseworkers, and we embedded them in the police station. And we come up with a program where the behavioral health unit, we love acronyms, so I apologize for using them, but BHU would then go out with the officers on patrol so they can anticipate problems. And any officer that knows his or her route well will know the individuals who are going to need these services. So if someone is in distress in the community, somebody dials 911, we would send the behavioral health unit out to the scene to assist. And depending on the circumstances and the type of incident, if it's a calm incident, there's not a lot of volatility there where somebody could get hurt, we would ask the behavioral health unit to take the lead. The officers would step back in uniform. But they're there as a precaution should something arise and get very aggressive and somebody could possibly get hurt. So yes, I would support something like that. I think the partnership though with law enforcement and the clinical services in the field would work well. And even going back further in my career, we did it with juveniles with the school department, and back then we took our officers in plain clothes and would just go on a preemptive strike, not so much as a 911 call. We would go to when we identify, the school would identify some of the youth in their schools who might need services or might have issues in the home, and a police officer in uniform with members of the faith-based community as well as social workers would then go visit the family just to chat. And that worked very, very well with the schools, and we made some great inroads in the schools, keeping those kids in class and engaged in their education.
Okay, thank you, Virginia.
I was hired last year actually as the consultant to the city of Lynn on their formation of the very first unarmed crisis response team in the city. And so I absolutely do believe that public safety and responses to public safety look very different and require different personnel and different professionals. I'll say this. Across the state, we have social workers and mental health workers who every single day respond to mental health crises. I have had to, the unfortunate need to section many people in my time to the hospital because they were a danger to themselves or others. It is important to recognize that each expertise has its place. And I'll correct my opponent just by saying that the BHU, the Behavioral Health Unit at the at the police department in Lynn, primarily actually responds in the aftermath of instances involving the police. This is important because the unarmed crisis response team that I was assisting both the chief of police in Lynn and the Lynn Racial Justice Coalition, as well as the mayor's office, in forming, is a response team that actually does go out during the incidents and the crises that take place. Now, this is something that's certainly changing, and the BHU is stepping more into co-responding. It's called co-response along with police. But we need responses across the spectrum. We need times when police officers are the only people who respond. And we also need times when social workers are the only people who respond, because the unique experience and the safety provided in both of those circumstances is necessary and protective.
Thank you very much. Kevin, would you like a 30-second rebuttal, since you did mention one specific thing about you?
Yes, I would just to reiterate what I said before. The behavioral health unit was part of a preventive medicine measure to stop crime. Many times the officers would identify somebody on their route who was in crisis. Might not be at the crisis level that someone's going to dial 911, but they got out ahead of it, and they would then contact the BHU, and they would come out in the cruiser, and the BHU folks would actually go on routine patrols with the officers, just doing, stops, well-being stops to just check on their clients on the patrol routes with the officers in a good faith measure to keep public safety at a premium.
Okay, thank you very much. A quick reminder to the candidates, I'm only one voter. The people who really matter here are the people of Essex County, so if you would be so kind as to look at the camera there by 1623 Studios or at your computer screen, those are the people that you need to be talking to, because my vote, I'm sure you'd like it, but those are a lot more votes, and those are going to count for a lot more. So please do stare at the cameras.
Duly noted.
Thank you. I appreciate the conversation, though. Moving on. How will you deal or address the racial and ethnic disparities in incarceration in the system at this moment? Virginia, you get no, Kevin gets the first, right?
Okay. When you're in incarceration, keep in mind the folks that are sent to jail are sent by a judge and or a jury after a trial of their peers, or a judge deems them to be held on bail or without bail. So the folks that come into the jail are there because the courts sent them and went. And I'm not looking at you anymore, Nathaniel. Sorry about that.
It's okay.
Because the court sent them there for a reason. So we in the jail, as I said before, honesty, integrity, respect. That's for everybody. That's for staff, fellow staff, inmates, visitors, attorneys, whoever may come into the building. Everybody's created equal. My opinion, individuals inside the jail should always be treated equitably, and based on what they need, not what the color of their skin is or their sexual orientation, religious beliefs. And when we do our programming and other parts of that stuff, we try to address those programs for whatever it may be. Maybe there's somebody in the LGBTQ era, or somebody that might be transgender, or somebody maybe of a Muslim faith or a different religious background. We do our best to provide the most wraparound services we can, and if we don't have it, we go outside and we research that. The inmates are there for a reason, and they're there to pay their debt to society, I guess you could call it, or await trial. And so while they're there, in addition to all that other programming and other stuff that's there, we want to make sure that they're treated fair and equitably. And as I said before, I hold my staff and myself accountable. And if that's not happening, we will make sure it does. Thank you.
Virginia, please.
So honesty and integrity and equity are words that we absolutely need to bring into the jail. But I'm not actually sure if when we do not address the very different life experiences that people have who find themselves in jail, both in terms of responsiveness to treatment needs and necessity to be engaging with treatment that actually is comfortable and safe for them, is really in the service of honesty, integrity, and equity. The reality is that here in Essex County, the two cities that are most impacted by crime and incarceration are cities that have high populations of people of color, people who may not speak English as their first language, and people find themselves in jail needing very specialized services. Diversity on a workforce is not simply a box that gets checked. It is an acknowledgement that when we come from different backgrounds, we bring different tools and skills for connecting and for treatment of people who need our help. If you look at the annual reports of the Sheriff's Department today, you will see that the executive team has a shockingly low amount of diversity. And this trickles down through the staff. It's important that at every level of leadership and care, we aggressively recruit qualified and diverse populations of people so that when people are in our care, they have the access to the kinds of language needs, of specialized supports that they need to be able to feel safe and comfortable.
Thank you both. We're going to get a little more heavy-handed here, so this is going to be a tough one. Virginia, are you ready?
Yes.
What are your views regarding local law enforcement or sheriffs collaborating with federal agencies like ICE?
So, the Sheriff's Department is really a department that has a clear lane. The lane is the care, custody, treatment, and rehabilitation of prisoners who are either charged with criminal acts and awaiting trial or who are serving lower level sentences. Now, I understand that there are other counties in the state of Massachusetts, currently only one of them, who have agreements with ICE and not only share information but also deputize their sheriffs to engage in ICE-related enforcement activities. The job of the sheriff is not to enforce federal civil immigration law. It is to stay in its lane and do the job of rehabilitation of prisoners who are serving time for criminal offenses at a lower level or who are waiting their day in court. It is not the space for sheriffs to coordinate or collaborate with other civil law enforcement agencies. And that's exactly what I will ensure as sheriff. I will not engage or entertain the concept of a 287G agreement.
Thank you very much, and thank you for the concise answers. Kevin, you're next.
I agree with my opponent on that one. Commonwealth versus Lund, which is a Massachusetts Supreme Judicial Court case that came out a couple of years ago, mandates that state sheriffs, state houses of corrections and jails can only hold somebody on state charges. So if an individual is in the Essex County House of Correction on a state charge, ICE may file what they call a detainer, which is a federal civil court order to hold that individual. So ICE gives it to us. We are legally bound to hold it, but when those state charges are done, so we know the individual is either his sentence has expired and he's going to be released, or if he's pretrial and he's going to be bailed, ICE is notified by law, but if ICE does not arrive at the time that the individual is ready to be released, we release the individual. So we don't hold anybody on an ICE detainer. We hold them on state's charges. And we do not participate in the 287G program, which my opponent mentioned, and that's correct. That's where you would go out and enforce immigration laws. We did not do that. When I was chief of the police in Lynn, we did not do that. I wouldn't go that route. I would like to make just one other comment about the population inside our jail and house of correction here. We have, as I said earlier, about 1,126 inmates, but because we are a jail and a house of correction, we house all types of individuals based on a whole slew of charges. Folks in our jails are charged with some of the most heinous crimes you can think of, all the way down to the lower level crimes, which is really the ones that we try to focus a lot of the energy with, some of the substance use disorders and mental illness. But there are some serious individuals in the jails who are charged with some very heinous crimes who will probably go to state prison. But that's why it's so important that we maintain a proper level of safety for all. And it is a law enforcement agency. We do perform law enforcement duties, and that's part of keeping the jail safe. Thank you.
Thank you both. Now that was a really difficult question, and I'm glad with the detail that you're both providing. We're at the halfway mark here, so I'm gonna give you a nice easy one. It's been very hot lately. What is your favorite summertime beverage or treat? Kevin?
Wow. That's,
It's important to get the human side of the candidates, guys. I mean, you guys are very good at the serious answers, and I appreciate that. But voters need to know that you're also people.
All right, well, I'm looking at the back of the room. A nice giant ice-cold lemonade would be awesome, but I don't see one, so but at least I answered your question.
All
But
right.
maybe we'll get one afterwards. How does
All
that
right.
sound? But that's
Thank
going to
you.
be ice-cold lemonade.
Great, Virginia.
It's funny because I've been, considering all of the possible questions that you might ask me today, and asking what my favorite food at this time was really not one of them, so my brain is scrambled as I think
Summertime
about that.
specific because of the heat.
Well, I will say that my children absolutely love watermelon, and every chance that we get, we go to the grocery store and we pick up some watermelon, cut it up, and eat it outside together.
That's wonderful. Thank you very much. All right, diving right back in. You actually have already answered two of the questions within your various comments, so that gives us time to address other critical questions. Are you in favor of decriminalizing drugs? Virginia?
This is a good question. My feeling is that we have a tremendous obligation to do all the research that we can about our opiate epidemic, as well as our other illicit drug epidemic in the county, and to be responsive and proactive about the ways that we can best improve the chances of people's survival from some of those crises, and also produce the circumstances that will allow for public safety. Now, I do acknowledge and I support the legislation in the state of Massachusetts that has not only decriminalized but legalized marijuana. I recognize, as the evidence has suggested among my other provider colleagues, that it is an accepted substance at this time. And at the same time, I recognize that it is very important that when people are using illicit drugs, drugs that have the potential to cause death, to cause harm to others, and that are addictive, that those people be funneled and directed very quickly and immediately to supports. So while I do not necessarily support the decriminalization of substances that are deadly in nature, I absolutely support the alternatives to sentencing and the supports that people can have as opposed to being charged with criminal acts and having to serve time.
Thank you very much. Kevin, can you?
I mean, I do not support the legalization of drugs. We've talked even here tonight quite a bit about overdoses and substance use disorders. You pick up the paper, there are still overdoses, still overdose deaths occurring every day. We're in a fight here with the opioid epidemic, and we've been like that now for several years. We need to continue that, and I think as we're doing in the jail now, as I've mentioned before, we need to really concentrate on two areas. What we're doing in the jail with treatment and rehabilitation for those that are already addicted, but I think we also need to put a lot of efforts into prevention before individuals go down that road. Now, if you recall, going back with the opiate epidemic, a lot of it became of drugs that were being OxyContins that were being issued because of back pain, and doctors were overprescribing them. That's how we got there. And then also, when you deal with the younger generation, like the younger kids in their teens or 18 to 24-year-olds, whose brains really haven't completely developed yet, but they're looking to find something risky to do, that's where they start going into the drug trade. At least that's what I have seen in my experience. We need to work with those folks, with some of our partners, which we do here at the jail with our reentry programs, to make sure we're giving those services, as well as the local police department, so they go out and they work with the kids in the schools and talk to them like human beings and educate them on the dangers of drugs so they don't start. And if we legalized them, I'm scared that it would really turn into a massive, much worse problem than we have. But so the two goals that I would stay with was continue the treatment and rehabilitation with programs. Again, we're doing them in the jail, we're doing them in our reentry, but there's a lot of great social service agencies in our communities that are doing good work, and they need to continue that. And I would also go back to the prevention measures, working with our youth, as they develop and get older, so they make good decisions, not only with the drugs, but also just good decisions for life skills.
I really appreciate the depth of your answers, both of you, and it would be remiss if we did not acknowledge the positive work and that effort that the city of Gloucester, just 4 miles down the road, has done here, where they've taken a very different approach, and it's been recognized throughout the nation as having very positive consequences by taking a non-criminal view of opioid users. And the question that you've now addressed on multiple substances is, I really appreciated the depth with which you both took an answer to that. Within many of your answers this evening, you talked about the racial disparities within our jails. And you've mentioned the racial issues of, Kevin, I believe you mentioned people are in there because they've done something, they're having to pay their time. But before they get to the jail, and before they are accused of a crime, there are many studies that have shown that there is a racial disparity in how law enforcement approaches different people, which means we have a disparate amount of convictions that are racially biased. How, in the role of sheriff, do you suggest the Commonwealth address this situation, which exists even within our county?
Mike.
Kevin, you're first.
That's a great question, and I'm glad it was asked. When you talk about racial issues with police officers, we all know that is a problem. We have acknowledged it. And I'll tell you, just because I was a police officer, I'm still in the law enforcement field, nobody likes a bad cop worse than a good cop. What we need to do is to continue to retrain our police officers and our deputy sheriffs and our correctional staff. Society lately in the last several years is changing dramatically. Not only issue of race, but equity and inclusion for all. And I think that's a good thing. What we have done in the jail, in the sheriff's department, is make sure we bring in good training programs so we can help open the minds of all our officers and all our staff so they can think outside the box. For example, implicit bias training. You know, that has been huge, and we mandated that as part of our training for annual in-service training for our officers. And every year we do a different version of it to give them a better reminder. You know, when I was chief in Lynn, you know, working with the Lynn community, the faith-based groups there, there was racial tension going on. There was. I'm not going to deny that. We got together with a group of the faith-based folks. We brought in a professor from Seton Hall University, and we met inside the Lynn Police Auditorium, about 60 of us. And I'm going to be honest with you, you know, we weren't all friendly. We were kind of coming at this issue from opposite sides. But we sat down with community members. We looked at the issues, we identified the problems, and we came up with solutions. And then we talked. And it wasn't easy, but at the end of those discussions, we saw each other's version of the events from a different set of eyes. And I think we made great progress in addressing those issues. And that's the kind of culture I wanted to change at the jail, or improve, because I'm not going to say anything is wrong, but you can always make improvements. And by continuing to train our staff and get them to think outside the box in other ways that you may not have done in the past, I think that's a win-win for all.
Thank you very much, Kevin. Virginia?
By increasing annual education and training by just a couple of hours, or by suggesting that large-scale conversations about race and equity is the sole solution to the problem of racial disparity and the history of use of force of populations and communities of color have suffered at the hands of not just law enforcement, but many institutions, including education, including in the judicial system and across the board, frankly, just is an insufficient response to what has been a centuries-long problem. The reality is that the faith-based group that my opponent is describing does not feel the same. I have heard that they do not feel the same way about the outcomes that occurred following those conversations. It's important to recognize that that implicit bias against all different kinds of differences is not something that you can just infuse into your yearly training. It's something that should be infused into every single day. in the support, supervision, and accountability of staff and other prisoners, as well as leadership. This is an issue that Essex County grapples with. We have high numbers of people from all different backgrounds, and yet we are tremendously segregated across the county. We have to come to terms with the need to be proactive and persistent as we train and work with our staff who have interactions with people of other colors, as well as recruiting diversity.
Thank you. Those are very thoughtful answers and detailed. I'm going to give you 2 more questions now. Virginia, it's up to you for the next one. And this one's you've mentioned you have children. Children are something that many of us have. It's something that many prisoners have. And what is your use of phone policy for inmates to maintain frequent contact with family, especially children? And can those calls be free?
The legislature in Massachusetts is at present grappling with this issue and acknowledging that charging for family connectedness is in essence antithetical to reducing recidivism. Studies have shown that recidivism is reduced when families stay connected and do the difficult work of healing while people are behind bars. Children who have not committed any crime deserve to have the opportunity to stay in contact with their parents when they are incarcerated. They have they deserve to be able to visit their family members while incarcerated and not feel as though they themselves also are incarcerated. I absolutely will use what the legislature has given to sheriffs, which is the power to discern between between charging exorbitant rates to family members and choosing to provide those services as an investment in recidivism reduction. Currently at the department, the Sheriff's Department in Essex County receives a 35% kickback from the cost of calls to families. And our current sheriff accepts campaign contributions from staff who are representatives of Securus, which is our telecom company. These represent conflicts of interest that simply do not lend themselves to reducing recidivism, nor do they lend themselves to improving integrity in our system. And I will not do that.
Thank you very much, Kevin. Since there was a direct accusation within that statement, you will get 2 minutes and 30 seconds, so you can just tie your rebuttal straight into there should you choose to.
All right, well, first of all, as a rebuttal, my opponent's using the word kickbacks. Kickbacks is gives a negative connotation. By law, the phone rates that we charge, the Sheriff's Departments and the Department of Corrections are allowed a commission. The commission that the Essex County Sheriff's Department sees on an annual basis is $600,000. By regulation, that money goes right back into inmate programs, all the stuff I've talked about all night here. The sheriff does not, or his staff does not use that for any other purpose except inmate programs. So when you talk about those type of things, it's the wrong word to use. I'm sorry. While I was sheriff in the last couple of years, I took it to the next step with trying to keep families in touch with each other. First of all, I went out to Securus, who is the phone vendor, and we got them to donate tablets for us, just like Bill Belichick has on the sidelines every Sunday in the fall. Each inmate is given a tablet, and they can make phone calls from it. They can order items from the commissary. They can participate in some of their programming duties. And most recently, their U.S. mail now comes electronically, and they can read their mail on the tablets. In addition to that, I instituted video visitation. In each of the housing units, we put in 2 visitations, just like what we're doing here with Zoom tonight, so the families of the incarcerated can stay at home, and they can talk to their loved ones over the Zoom camera like we do here. One of the things that affected me as sheriff, when I look out my window before we had video visitation, we'd see the Ubers and the taxi cab dropping off the mother and the little children and bringing them inside a jail. The jail is a jail. There are high fences, barbed wire. It is built to keep people inside. And have a little kid come up and see that, I think it's a little traumatic. That's why I went to the video visitation, to do that, to ease the burden on the family and let them see that. In addition to that, we also have video court. We use video systems with the district courts and the superior courts in the county as a safety measure, using electronics to keep the inmates in the jail, and they normally prefer that, and it's also a safety measure, so not taking them out into the jail, out into the public where there's always a threat of escape. So we're trying to use technology as best we can. It is working, and it is making the strength to our whole reentry program, which is based on participation of the families. And in terms of donations from Securus, all my donations are on the state website, OCPF. You can look at them, and all my donations are perfectly legal. You're welcome to look at them, examine them, and question them, but they are perfectly legal.
Thank you very much, both of you. We're coming to the end of the evening. We've got 2 more hard questions. I'm afraid we're not going to end with an easy one, so you can keep fun comments for your closing statements. But we'll start right away. Kevin, what are your views on private prisons?
I'm not an advocate for private prisons. First of all, as sheriff, I was elected by, the citizens of Essex County. I'm held accountable to the citizens of Essex County. I have a background in law enforcement. I believe I know what I'm doing. I do a good job, and the citizens trust me with what I'm doing there. Private prisons have historically had some issues, and if they're for profit, then you got to question what are they doing there too. I know that there's a private prison in another state here in New England has had issues, to the point even the federal U.S. Marshals have taken their prisoners out of there. I think a state-run facility that's monitored funding-wise by the governor and the state legislature, run by a state-elected official, is the best bang for the buck and gives the best services to the inmates that we serve in cooperation with the families and all the other folks that we partner with in society. And we also, because I'm a sheriff and we're elected, we have that individual buy-in to do the best job possible, as we keep saying, to support reentry success. And I'm not quite sure you would do that with a private entity that's running that, a prison or a jail.
Thank you for the succinct answer. Virginia.
Yes, I am not in favor of private prisons, and I'm very glad that in Massachusetts our county jails and houses of correction are publicly run. Part of the reason that I have concerns about private prisons is exactly because of the conflicts of interest that exist when folks are put in a position where they can both make profit off of keeping people incarcerated. The reality is that we might have issues that are legal, but they may not be ethical. And this is precisely why I have deep concerns about some of what I would consider the unethical choices and issues that put our taxpayer dollars in conflicts of interest right here in Essex County. As a social worker, I'm bound by a code of ethics that acknowledges that dual relationships are inappropriate when it comes to providing treatment. It acknowledges that conflicts of interest make it more difficult for us to provide the kind of straightforward and laser-focused, goal-oriented treatment of reducing recidivism. This is why I mention that we really need to ask the difficult questions about what does it cost at the jail and to be connected to our loved ones, to receive some of the services that people receive, and why are we actually considering these things appropriate. I do not think that privatizing services is appropriate. I do not think that profitizing services is appropriate. And I also think that those things do not fall in line with the ultimate goal of reducing recidivism. I will not engage in those kinds of conflicts of interest, and it's very much related to the reasons that I do not believe that private prisons work.
Kevin, 30 seconds for rebuttal.
Folks, I've been in law enforcement many years. I've been a public servant for many years. I believe in honesty, integrity, respect, as I said. I believe my reputation precedes me. I have an impeccable record, both in the Lynn Police Department and working for the Commonwealth of Massachusetts. I do not appreciate anybody taking shots at my reputation. I take that very serious. I take my job very serious. It is legal, yes, and we have taken, donations, but one of the things that I did when I ran for sheriff, I took the politics out of the Essex County Sheriff's Department. I refused to take donations from any employee.
I'm afraid you have to stop there.
I'm sorry. Okay.
All right, for our final question this evening, not an easy one, Virginia. Actually, no, Kevin, sorry, because you were just having the rebuttal. What is your policy on solitary, and how long is somebody allowed to be kept in solitary?
Solitary is now called restrictive housing. Inside a jail like ours with 1,100 plus inmates on a daily basis, you are going to have problems. You are going to have inmates who are going to act out, and you have to have some form of discipline. We call the restrictive housing unit when someone is put in there for a violation of the honor code, the disciplinary code. There are hearings that are done before someone's put in there, and then there are hearings done every other day, Monday, Wednesdays, and Fridays. It is a necessary thing to have safety inside the jail because, again, keep in mind the type of individuals we are dealing with. They go from A to Z in the criminal justice system, and safety is the number one reason. As in terms of how long somebody is in there, our populations are very transient because we're a county house of correction and jail. So our average stay for those that go in and out of restrictive housing unit is 15 days. We do have, part of that is folks that are under protective custody, and that's usually a voluntary thing. When someone's in there and they're afraid to go into a general population unit, they can request to go into restrictive housing, and they can be there longer depending on their request, but that's on a voluntary thing. So, and we also do have categories in there when someone is put in there due to classification issues, but that's just more short-term time. But to answer your question directly, Nathaniel, it's really 15 days is the average for somebody that's in the unit that's just in there for disciplinary reasons.
Thank you. Virginia?
Safety does not have to include soul death. And I do not believe that solitary confinement is an appropriate response to safety issues at the jail. I do, however, believe that isolation can be and is an important tool for responding to safety issues, whether it be by prisoners who are a danger to others or who are experiencing targeting themselves. But in my opinion, when we talk about solitary confinement, this is spending the 23 out of 24 hours of the day by oneself and isolated from even the kinds of services that one needs, or receiving services that are not HIPAA compliant. It is in my view that when we engage in isolation for people, that we really have to make sure that they have access to the programming that is helping to move people through the process of their treatment and their rehabilitation, as opposed to warehousing people for days on end without interaction with other human beings.
Thank you both. And those conclude our questions. There were many, many more. I'm glad to see that they came from all over Essex County. Before we go to the closing statements, I want to make a very clear statement that I'm deeply grateful that we've had a robust conversation. We've gotten into real substance here. This couldn't be possible if the candidates weren't willing to participate. So first and foremost, thank you to both of you. It's critical that other people participate in this. And so thank you for the people who are on Zoom, for the people who are watching on the recording. Thank you to Gloucester Daily Times and 1623 Studios for making this accessible to all of Essex County. An informed voter means a good voter, and that's good for democracy. Thank you for this wonderful evening. I've learned quite a lot. I hope everybody else has, and that we found this productive. For closing statements, we'll go in the reverse order that we started with opening statements.
Well, thank you again, Nathaniel. Thank you to the Rockport Dems and to the viewers. I appreciate your time and for you to listening and get educated on the role of the sheriff. As you've heard tonight, the role of the sheriff is very diverse. It's a large and a very, very important piece of our criminal justice system. When I talk about budgets that I did when I opened my opening statement, I have a $78 million budget, 600 individuals that work directly for me, and 200 vendors or volunteers who come in on a daily basis. That's a lot of responsibility for a sheriff to have to operate under, to make sure they're safe as well as the inmates, but to just do the day-to-day administrative functions of that job. that takes years of experience, and you need somebody in that position that can handle it and has the expertise and has done it before. I have that experience. When you look at the number of agencies that we assist in the Commonwealth, in the county, through the law enforcement role that we have, we are a law enforcement entity. We routinely help all the local police departments. Even just go back to the Merrimack Valley gas explosions a couple of years ago. We were on the ground in there for weeks assisting local law enforcement. We do that frequently with resources upon request from the local police. But the whole goal, going back to my original platform in 2016 and the promises I made when I ran for sheriff, I think I have done I have succeeded in fulfilling those promises, and I want to take it to the next step. We look at the opioid epidemic, we have done a lot. We have the medication-assisted treatment. We have the clean and sober existence unit. We brought in those companies like Spectrum Healthcare, the experts in the field, to come in and deal with the substance use disorders for those individuals. When you look at the mental illness aspects of crime and the individuals in our jail, we do a routine screening for those when they come in. We've identified them, and then we service their needs. We service the needs by hiring clinicians. We have about 30 clinicians on staff who are there every day to assist the inmates with their mental illness, to help them address it and give them the best services. We took it a step further, and I hired a director of clinical services, a woman who's very well versed in the trade, excellent reputation with the inmates, and a great demeanor to help accomplish the goal of addressing the mental health in our jails. The office of sheriff is for a sheriff. It's not for a chief clinician. It is something that we're doing now, and I think we're doing a very, very good job. When you talk about all the other programs we do, we have over 100 different programs, and a lot of those programs we can tailor-make to the individual's needs so we can give them a best chance of reentry services. And when I talk about reentry services, I mentioned a couple times our STAR program. That was my idea since day one. And I started to roll it out 3 years ago, and what happened? We had COVID when it came and shut down the world. So we did kick it off this past April, and it's been successful. We have offices in Lynn and Lawrence, and it not only services the inmates when they come out of jail, but it also serves inmates who maybe the gentleman or the lady may be in front of a judge in the court of law, and the judge is trying to decide, should I send this individual to the jail, or should I leave him at home, or is it middle ground? We went to the judges, we sought their input, we come up with this program. It's based on individual needs. The judge can actually sentence the individual to our STAR program, require them to go to classes at the STAR offices. We can do drug testing there. We can tailor-make the needs for the individual so they get the services that they want. It's gone to even another level, going back to in Lynn. Lynn Police has a bicycle unit that patrols downtown, where a lot of their homeless and individuals suffering from mental illness often congregate. The bike team now asked if they could refer individuals off the street on a voluntary basis to our STAR program, and they have done that, and we have seen success. This is the future of corrections. We want to bring it up again to raise the bar in corrections, make it more professional. We're doing it each and every day by innovative ideas like this. And our next step, should I be elected to another term, is to address transitional housing and post-incarceration employment. We have work release programs now within the jail while the inmates are still in custody here. The next step in my goal is to take that outside once they're released and help them get employment based on the training we're providing them while incarcerated, but take the next step, find them a job so they can get a paycheck, stay united with family, keep that job going, and become re-engaged with community as productive members. So thank you all again very, very much. I appreciate your time.
Thank you much. Virginia, please.
As a student of history and criminal justice reform, I think a lot about punishment. I think about what its purpose is. I think about what the goals of punishment are. And I think a lot about what the ultimate outcome is when we mete out appropriate punishment. We have a moral imperative in this country to acknowledge second chances as a fabric of our democracy. And when I think about the history of the carceral system, the penitentiary was something that was created, a concept that was created by Quakers a very long time ago as a response, a human-centered response to the kinds of corporal punishment that were being meted out in response to criminal acts. The reason that Quakers felt that people could be rehabilitated was because they acknowledged that as human beings, we have redemptive qualities and we can be redeemed. And this is very much the spirit with which we began our correctional system. And it is very much the spirit with which I hope to continue the progress towards rehabilitation and acknowledging and responding to and providing the kinds of consequences, natural consequences to people's poor choices or people's circumstances and environments that have caused them to cause harm to the community. There is a real distinction between the profile of a law enforcement officer and the profile of a social worker. This is what we do, is we see the world differently. We are both necessary, but we respond differently to the world around us. We have different lenses from which we solve problems. We have different lenses and tools to respond to crises, and we have a very different lens about how to mete out consequences and ultimately successful rehabilitation. Here in Massachusetts, we have examples of other human services professionals who have led the country in their innovations as sheriffs and as correctional facility administrators. We have the opportunity this year, the rare opportunity, to consider what our view of punishment is in the County of Essex, what kind of justice system and we want to have, and what kind of tools and supports we want to make sure that people who have made mistakes receive while also holding them accountable. We need a place for both of these profiles, but the Sheriff's Department is the place for human services. It is the role of the Chief Rehabilitation Officer. And it is so important that we acknowledge the vast and depth of the experience that is required, then that is asked of human services professionals when we step into this job. It's not about checking boxes. It's not about just making sure that things are ticked off the list. It's about a real commitment to a culture of rehabilitation as opposed to retribution. I am so honored to be on your ballot this year. And I ask you, as you consider who you vote for in this September primary, to also consider the very vulnerable residents, your own public safety, and our investment in rehabilitation as you look all the way down the ballot. And I humbly ask you for your vote as you consider this election. I thank you so much, and I'm grateful to all the hosts tonight who have helped us to bring visibility to these issues.
Thank you both. Before we conclude this evening, I too would like to thank Barbara Gavin, who's been our faithful timekeeper, who has kept you both in line. So she is too has been an enforcing officer of this part. But the two candidates, I would like you to take a moment to acknowledge two people who are in the room who we could not be here if they had not done the enormous amount of work it took for you to be able to be here. So could you please both personally thank your managers now?
Oh, thank you so much.
Call them out by name. They do deserve their credit.
Elaine
and their team
Almquist
members.
is my campaign manager, and I'm deeply grateful for organizing and responding to all the many emails that come through our system every day and keeping us on track as our guide. Thank you.
And Kevin, some words about Dennis, please.
Well, I'm going to skip Dennis because I want to talk to the boss. My wife, Beth, is you know, I don't want to get drama here, but I mean, Beth is the best thing that ever happened to me. She keeps me in line. She works very closely with Dennis, but she's the rock that I rely on, and thank you, Beth.
I appreciate that.
Sorry,
but
Dennis.
I do have to acknowledge Dennis did answer a tremendous number of emails and phone calls. So thank you both Mrs. Coppinger and Dennis. Thank you all three. Thank you 1623 for making this accessible to all of Essex County, and thank you to Rockport Public Library for this wonderful evening. Thank you all.